Hello, Armidale Family Daycare Educators, and welcome to this presentation on safe sleep practices for family daycare educators. This presentation is based on current Red Nose Australia advice. We hope that you enjoy it and that you learn something useful. So we will first begin with a quick introduction to safe sleep and the importance of safe sleep practices within the family daycare setting. Safe sleep practices significantly reduce the risk of sudden infant death syndrome, otherwise known as SIDS, as well as other sleep-related accidents. Complying with safe sleep guidelines makes sure that we comply with the national regulations, as well as providing a safe environment for infants. Educators who follow safe sleep practices offer reassurance to parents who know their children are in a safe and caring environment. Red Nose Australia was established in 1977 and has been the leading authority on safe sleep practices and SIDS prevention since then. Red Nose is dedicated to saving the lives of babies and children during pregnancy, infancy, and early childhood, as well as supporting bereaved families. Red Nose also provides lots and lots of resources and support, such as evidence-based guidelines, educational resources, and support services for parents, caregivers, and educators. Now, what do the laws and the regulations say about safe sleep? First, we'll look at the laws. Section 167(3) says that we need to ensure every reasonable precaution is taken to protect children from harm and hazards. Regulation 84A then says that we need to ensure children's sleep and rest needs are met with consideration to their ages, developmental stages, and their individual needs. Regulation 84B states that sleep and rest policies and procedures must be in place. You can find our policies and procedures on our website, and you all have your own specific sleep procedures for your service. This leads on to Regulation 84C. Each service has a specific risk assessment for the purpose of sleep and rest. Next, we have 84D, which says no bassinets are allowed at all. Some associated regulations include 168, services must have policies and procedures for children's sleep and rest, and as we just discussed, we do. They are available on our website for you to look at. There are also some other relevant regulations, including section 115 and 165, that's of the law actually, which relates to supervision, and then regulations 103 and 105 relating to equipment, and regulation 110, which discusses ventilation and natural light. Having just looked at the laws and regulations, we will now look at what the NQS says. The NQS has two main quality areas related to safe sleep practices. First, we are looking at quality area 2, children's health and safety, and then quality area 3, the physical environment. When looking at quality area 2, children's well-being and comfort, we need to make sure that each child's well-being and comfort is provided for. This includes appropriate opportunities for sleep, rest, and relaxation. This could look like you responding to baby's cues for tiredness, providing them with an appropriate sleep or rest area. National Quality Standard 2.2.1 states that at all times, reasonable precautions and adequate supervision ensure children are protected from harm and hazards. For educators such as yourselves, putting this into practice, Some examples could be arranging furniture, such as beds and cots, to be easily accessible and to enhance supervision, or also completing your 10-minute sleep checks. Both of these strategies can minimize the risk of harm and hazard to babies and to children. Moving on to quality area 3, we have 3.1.2, which states that premises, furniture, and equipment are safe, clean, and well maintained. Again, for you in your service, this could look like having safe cots and porta cots that comply with the Australian standards, they're in good condition, and they are well maintained. One way that we ensure they are well maintained and appropriate for use is by giving you a cot safety checklist to complete each year at re-registration. We have looked at the regulations, the laws, the NQS, and we will now look at what Armidale Family Daycare has in place for children's safe sleep. We have a children's sleep and rest policy. This is on our website and contains lots of information and guidance for complying with the regulations and the laws, as well as their NQS. Within this policy, there is a safe sleep procedure, and this is basically the how-to of keeping children safe during rest times. Each service then has their own individual specific sleep procedures. These detail what happens during rest time at your service and with the children in your care. Each service and educator also has a comprehensive safe sleep risk assessment. Again, this is specific to your service, the children in your care, and is used to mitigate any potential risks. Right, now we are going to look at the Red Nose Safe Sleep 6 recommendations. The first recommendation, number 1, always place baby on their back to sleep. By placing the baby on their back to sleep, this helps to keep their airway clear and ensures that their protective reflexes work. Back sleeping reduces the risk of suffocation, overheating, and choking. Number 2, we need to keep the baby's face and head uncovered. Babies actually control their temperature through their face and their head, so by keeping their face and head uncovered during sleep time, this helps to reduce the risk of overheating. Again, it also helps to keep their airways clear, which reduces the risk of suffocation. Number 3, we need to keep the baby smoke-free before and after birth. Smoking during pregnancy and around the baby once they are born increase the risk of sudden infant death, and this includes secondhand smoke. Obviously, we can't control what happens within the baby's home environment, but we can make sure that the family daycare services are completely smoke-free environments and safe for our children. Number 4, we need to provide a safe sleeping environment night and day. The safest space for baby to sleep is in their own safe space with a safe mattress and safe bedding. The baby should always be placed on their back to sleep with their feet at the bottom of the cot. We need to ensure we have safe cots that meet the Australian standards, AS2172. We need to have a safe mattress, which is firm, flat, and the right size for your safe cot. Safe bedding includes having lightweight bedding that is firmly tucked in and only pulled up to the chest. A safe sleeping bag is also another option for babies. This needs to be well fitted across the neck and the chest with baby's arms out and no hood. Number 5, we need to sleep the baby in their own safe space in the same room as parent or caregiver for at least the first 6 months of their life. The safest place for the baby to sleep is in their own space with their parent or adult caregiver. This is always something to consider if you have very, very young babies in your care when you're thinking about where to position their cot in your environment. Number 6, breastfeed baby. Breastfeeding has been shown to reduce the risk of sudden infant death. We are a breastfeeding friendly practice and we can support mothers and parents to breastfeed their children, providing them with a nice, calm, comfortable place to do so if they wish to, and even feeding them express breast milk. When creating a safe sleep environment in family daycare, we need to make sure we are choosing the right cot and mattress for the setting. These cots need to meet Australian standards. For a fixed cot, they should meet Australian Standard 2172 2003, and for portable cots, they need to meet Australian Standard 2195 2010. The mattress should be firm, clean, and fit snugly within the cot with no gaps larger than 2 centimeters. You should regularly check the mattress condition for wear and tear and replace it if necessary. We need to ensure the sleep area is free from hazards. Check the room, position the cot away from curtain cords, hanging decorations, and any potentially dangerous objects that could be pulled down or fall into the cot. There shouldn't be any soft bedding, especially for babies under 7 months. All babies in a cot shouldn't have pillows, quilts, or doonas or cot bumpers. Babies under 7 months should not have soft toys either. You need to maintain a comfortable room temperature and dress the baby appropriately to avoid overheating. Dress them appropriately for the room temperature, ensuring they sleep on their back with their head and face uncovered to prevent overheating. When adapting the home environment to meet safe sleep standards, we need to make sure there is a dedicated sleep area. This needs to be specific, quiet, and safe for infants, separate from main play areas if possible. You should conduct regular inspections and safety checks to ensure the sleep environment remains hazard-free. You can also make this part of your indoor safety checklist. You also need to have a plan for emergencies and be prepared if you need to give first aid, if you need to evacuate, anything like this. We also have risk assessments and safe sleep procedures. You should implement a specific risk assessment for your service for safe sleep. These are similar to those used for excursions. They can help you to identify and mitigate risks that are specific to your service and the needs of the children within your care. Your sleep procedure should also be individual for your service. When the child is being put down to sleep, you need to ensure you remove all choking hazards such as hoodies, tops with cords, dummy cords, teething necklaces, and hats. This is because these items can tighten during sleep and pose a choking risk. Ensure that the environment has adequate light for sleep monitoring and supervision, ventilation, and uncluttered space, no hanging cords or decorations like we just mentioned. For older children, ensure they have a personal space to relax and enjoy some quiet activities. We're going to look at how to make up the baby's cot in a little bit more detail. We need to make sure we use a safe cot that meets the current Australian standards. We also need a safe mattress that is firm, clean, and flat, and not tilted, not elevated, just the right size for the cot. We must sleep the baby on their back, keeping their face and their head uncovered. Their feet are also to be positioned at the bottom of the cot. Any blankets must be tucked in firmly, or you can use a baby-safe sleeping bag. It's also useful if the mothers can breastfeed the baby, if we can keep the baby in a smoke-free environment and provide a safe environment day and night. Do not use pillows, doonas, soft toys, cot bumpers or lamb's wools anywhere in the cot. Also, do not put the baby to sleep on a waterbed or a beanbag. I'm sure you won't be doing that. We will now look at monitoring and supervision in family daycare, the importance of this and what it could look like for you guys. So, first we will look at the importance of regular sleep checks and monitoring during sleep times. By regularly checking on sleeping babies, we can ensure they are safe and in the correct sleeping position. This helps to quickly identify and address any potential issues. We schedule checks to make sure that we have consistent monitoring. For us in family daycare, these checks need to be no longer than 10 minutes apart. To help us to remember to do this, you can use a timer. You could use your watch as a timer, your phone, an alarm, anything to help you remember to do these important checks. We also need to document these sleep checks as evidence. Now we'll look at using baby monitors and other safety devices effectively. These devices could be audio and video monitors. Baby monitors may be used as an additional aid whilst babies are sleeping, but they do not replace the 10-minute physical checks. Even if you are frequently checking a baby monitor, you still need to carry out 10-minute sleep checks. This means you have to be in the actual room where the baby is sleeping and you need to check on them. Checking on them involves looking at the rise and fall of their chest, that they are in the right position in the cot, still on their back with their feet near the bottom, and you're also checking things like skin and lip colour. We also need to look at the training that we receive for safe sleep, such as this, what we're doing now. Comprehensive training can provide caregivers and staff with the knowledge they need to implement safe sleep practices. This includes how to create a safe sleep environment and the importance of regular monitoring. We also make sure that all our educators are trained in first aid for emergency situations, so they have the skills and the knowledge of what they would need to do if they found a baby unsafe or in signs of distress. Armidale Family Daycare will continue to offer continuous education opportunities to keep you updated on the latest safe sleep guidelines and best practices. These practices include you always being within sight and hearing distance of the sleeping child, preparing for additional supervision that could be needed for children with medical conditions, developmental needs or sleep issues, as well as children who are recovering from an illness, as they will probably need closer supervision. So one question that we often get asked quite frequently is, can the baby have a soft toy or a comforter in the cot with them? Now for babies who are birth to 7 months old, we should avoid using soft toys or comforters completely because of the high risk of sudden unexpected death in infancy. 90% of these cases occur during this period before the baby is 7 months old. The risk of suffocation and strangulation outweighs any benefits. For infants who are 7 months and older, the risk of SUDI and SIDS decreases after 7 months. Soft toys can help with separation anxiety, especially in the age bracket of 7 to 20 months. Red Nose still recommends no items in the sleep space for the first 12 months, but once 7 months has passed, you can begin to discuss with the parents and make sure you're meeting their needs and work this out with the families. When choosing a soft toy or a comfort item, you need to ensure it meets Australian safety standards. It should be small, not pillow-like, and with no long fabric attachments. The use of it needs to be monitored. It should be removed if the baby covers their face or their head with it, cannot move it away from their face, or use it as a pillow, making their chin be on the chest position. Also, if they use it to lift themselves up, they have an increased risk of falling, and if they put it in their mouth, it becomes a choking hazard. Again, it should be removed. It's really important in the family daycare setting that we follow National Quality Framework Sleep and Rest legislative requirements and refer to Red Nose guidance and our service policies. Key points here to recap: we need to avoid soft toys in the sleep environment for babies up to 7 months, ideally for the first 12 months. We need to weigh the risks and benefits for older infants in conjunction with their parents. We should follow Safe Sleep, Red Nose recommendations wherever possible and monitor the baby's interactions with the comfort item. Now we will look at some other common questions in relation to safe sleep practices. The first one is, can the baby sleep with a dummy? Yes, they actually can. The baby may sleep with a dummy depending on the family's preferences. Dummy use has been found to decrease the risk of SIDS and can be effective at helping baby settle. Although there are some negative effects of dummies, these include that they can cause a higher incidence of respiratory, ear, and gastrointestinal infections. It's really important to communicate with the family and to respect their wishes in this situation. Can the baby sleep with a bottle? No, they can't. Sleeping with a bottle is not advised and it is not permitted within Armadale Family Daycare. Although bottles can help to settle a baby to sleep, they must not be left in the cot with the baby. It's fine for an educator to feed the baby a bottle, but then the bottle needs to be removed. According to Raising Children, using bottles whilst asleep can increase the risk of choking, vomiting, tooth decay, and possibly ear infections. Can I use a bassinet, pram, or car seat in family daycare? No. These are not safe sleep surfaces and increase the risk of sudden infant death syndrome. The national regulations also state that bassinets are not to be used in family daycare. Can I wrap or swaddle a baby? Yes, wrapping can help to settle babies, reducing crying time and episodes of waking. It may also help to keep them in the back position. When wrapping a baby, we need to ensure the baby is positioned on their back with their feet at the bottom of the cot, that he or she is wrapped from below the neck to avoid covering their face, and always sleep with their baby's face uncovered. You should only use lightweight wraps such as cotton or muslin so as not to cause overheating. For wrapping to be effective, the wrap needs to be firm but not too tight. If the baby is being wrapped, it's important to consider the stage of development. Their arms need to be left free once the startle reflex disappears, which is normally around 3 months of age. It is essential to discontinue wrapping as soon as the baby starts showing signs that they can roll. This is usually between 4 to 6 months of age, but sometimes it can be younger. What is a baby-safe sleeping bag? A safe sleeping bag is constructed in such a way that the baby cannot slip inside the bag and become completely covered. The sleeping bag should be the correct size for the baby, with a fitted neck, armholes or sleeves, and no hood. When using a sleeping bag, ensure that the baby is dressed according to the room temperature. Now we'll look at communicating with families and parents in family daycare. It's important to have open communication. This helps to establish a trusting relationship with parents and families by being open and approachable. We need to encourage questions and address concerns. This helps us to discuss safe sleep practices with parents. Family daycare educators should freely share information about their sleep and rest policies and practices. Some common questions from families may include, can I see where the children sleep? What do they sleep on? Can they bring something from home to comfort them? Is furniture moved around? How do you ensure all children are safe? Do you stay with them? How can you accommodate my child's individual needs at sleep time? How is the environment made comfortable? For example, noise, light, and temperature. We need to engage families in these kind of conversations about their child's individual sleep and rest needs, considering different cultures and values. If a family's request conflicts with professional advice or poses a risk, seek guidance from your provider or your coordinator to find a safe and ethical solution. We're always here at the office waiting to talk to you and to work things out with you. It's also a good idea to provide educational materials to family, such as brochures, handouts, and links to reputable sources like Red Nose Australia that explains safe sleep practices. You could always show parents how to set up a safe sleep environment and demonstrate the correct way to place a baby to sleep. As an early childhood professional, supporting families by sharing advice and resources from Red Nose and the New South Wales Regulatory Authority is important. We always need to prioritise safety and follow service policies, procedures and practices. To conclude this presentation, I'm going to give you a quick recap of some of the key points that we've talked about. Safe sleep practices. We have emphasized the importance of placing babies on their back to sleep, keeping their heads and faces uncovered, and maintaining a smoke-free environment. When creating a safe sleep environment, we highlighted the need for a firm, clean, flat mattress in a safe cot, and for babies under 7 months old, no soft toys or comforters, ensuring the sleep area is free from hazards. We then talked about monitoring and supervision and stressed the importance of regular checks during sleep times, using baby monitors effectively, and training staff and caregivers on safe sleep practices. When communicating with parents, we discussed how to effectively communicate safe sleep practices, provide resources and support, and encourage consistency in safe sleep practices at home. Armadale Family Daycare is committed to safe sleep within our practices. We encourage educators to commit to implementing and maintaining safe sleep practices to protect the well-being of infants in your care. We've also highlighted the importance of ongoing education. This helps us to stay informed about the latest safe sleep guidelines by continually educating ourselves, educators, staff, and families. We've reminded you that there's lots of support and resources available from organisations such as Red Nose Australia, which can help you to create and maintain safe sleep environments. After this presentation, you will be sent a questionnaire to complete. If you complete these questions correctly, then you will all be provided with a certificate stating that you have completed this safe sleep training effectively and successfully. Thank you all for watching this presentation and for helping to keep children safe in your service.